Hello everyone, and welcome to another episode of Ask Dr. Bob. Some very interesting questions today once again, and we'll get right to it. Dr. Bob, how do you get too much copper in your body? And that really is an excellent question, and nobody really has ever asked that before. Generally, you get too much copper because you don't have enough zinc. And you have elimination of zinc by eating wheat and soy products. So wheat and soy deplete zinc. Body signals of zinc deficiency are large pores on your face, white spots on your nails, maybe heel pain. I also know that people who do not have enough zinc have poor fat metabolism, and the poor fat metabolism can result in pain. You could also have some memory issues as a part of your brain called the hippocampus. The hippocampus has a lot to do with short-term memory and just memory in general. So the hippocampus could be impacted because not enough zinc. Sugar will deplete the body of zinc. In our practice, we use a product called Zinczyme, but it's even more interesting is we have a product called Aqueous Zinc, which is the zinc taste test, and you may consider obtaining a bottle of this and taking a capful and see if you can taste it or not. And if you would like to, contact us at customercare@druglessdoctor.com, and we can literally send you the zinc taste test. Dr. Bob, I want to get off of Effexor. I'm taking about 75 milligrams of every day. How do I go about doing this? Well, first I want you to know I do not have a license to take anybody off of any medication. But in Dr. Bob's Guide to Stop ADHD, there are certain principles we follow, because the fat metabolism that impacts ADHD is the same that would cause some depression and some other behavioral and emotional issues. So my first suggestion would be to have an essential fatty acid blood spot test done. Also have your thyroid tested, because subpar thyroid is a very common cause for depression, which I'm assuming that you're on the Effexor because of depression. But if you don't have enough fat, and I would do a search on this, DHA, it's a long chain fatty acid, with a deficiency of that, you could have some depression issues. My eyes burn, this is number 3, and I have pressure in my eyes. I'm 62 years old. I've started light yoga, and I'm walking and breathing exercises. What should I do about my eyes? What's very interesting is that we have a product that we have used in the past called Carbamide Plus, and that happens to help get rid of and minimize extra fluid in your body. And we also use a product called Optic Plus with that. So that's what we have used successfully for people who have a lot of pressure in their eyes. Of course, you want to be checked by your eye specialist just to see what your exact pressure is in your eyes. Dr. Bob, I want to know the remedies for calcification of arteries. I would encourage you to do a search on a term called glycation. Glycation is when sugar and protein come together and create inflammation. That's one of the reasons I do not promote yogurt. That's one of the reasons I don't promote ice cream. Sugar and protein create inflammation. As a matter of fact, when we take films of our practice members and we take a side lumbar film and we notice calcification of their large blood vessels in their abdomen, one of the first questions I always ask them is if they eat ice cream. And it always happens that invariably it's yes, they have ice cream on a regular basis. People in the world love ice cream. Ice cream causes inflammation. It's pretty much simple. You stop the ice cream, you stop sugar. I would stop dairy products and add oil. Once again, I'd encourage you to have an essential fatty acid blood spot test done. Last question. It's very common in our practice. Doesn't ask too often here on Ask Dr. Bob. I have suffered with fungus on my toes for years, and they want to remove them. And I've had individuals come into my office where they've taken their toenails off. It was really interesting. Do you have a remedy for toe fungus? Well, a toe fungus is not because of your toes. It's because you have a fungus and a yeast problem that's going on in your colon. And I would encourage you, and we've had great success using emulsified oregano and a probiotic. I would watch this program over again. There's a lot of really good questions. Thank you so much for watching these videos, and we're making a difference in people's lives around the world. I'm Dr. Bob DeMaria, the Drugless Doctor.